to HC Medic. Today we will discuss about pharmacokinetics drug distribution. So let's begin. Before discussing distribution, let's revise absorption very quickly. Now, we will take example of oral route. The drug enters into the GIT and then it is getting absorbed to the intestine and it will pass the liver and will have first pass metabolism, then it will enter into the systemic circulation. This is what we call absorption. Now after this, the drug will enter into the tissues, which we call distribution. Let's see. The drug entering the tissues from the systemic circulation is called distribution of the drug. Now in distribution, we have two types: the central compartment distribution and the peripheral compartment. Central compartment includes three vital organs, which is the brain, liver and kidney, which is having very high blood flow. The peripheral compartment includes skin, fat and the heart. The central compartment has very rich blood flow, very instantaneous blood flow, means the drug will reach the central compartment first. The peripheral compartment has moderate blood flow, so the drug will reach it later. So any drug will reach the central compartment first. That is, we have to understand, it is important. Now let's see the volume of distribution, which is a very important topic to understand under the distribution. It is also called apparent volume of distribution, AVD. Now what does it mean? Let's see the formula first. AVD or apparent volume of distribution is the dose of drug administered by IV route upon the plasma concentration of the drug. Now let's see the definition. What does it say? It is the volume that would accommodate all the drug into the body, which is homogeneous. We are considering this homogeneous if the concentration throughout is same as that in the plasma. It means that we are considering that the tissue and the plasma will be homogeneous states. Okay, this is just an assumption for the definition. Now let's understand it. Now here we are giving an IV injection directly into the blood circulation, right? We are giving IV and the administered drug has a dosage of, we are taking example of 100 milligram. And now we are checking the plasma concentration of the drug, which is 5 milligram. So now let's calculate 5 milligram per liter. So let's calculate the volume of distribution, which is dose administered divided by the plasma concentration. So it is 100 divided by 5, which means 20 liters. Now what does this indicate? It is important to understand. Now first see that the total blood volume is like around 5 liters, right? 5 to 6 liters. And if the AVD is more than 5 liter, we consider, that is, like example is 20 liters, it means that the distribution is high, the volume of distribution is high. Because 5 liter, if we divide this 20 liter to 5 liter and 15 liter, the drug will remain into 15 liters into the tissues, so it will have high volume of distribution. If AVD is less than 5 liters, means that the drug does not penetrate the tissue much, because it will have a very less concentration, less AVD, it will remain into the blood circulation only. Now we will see the factors determining the volume of distribution. So first is the molecular weight. Large molecular weight drugs, or we can say drugs having high plasma protein binding, generally have very low AVD because they do not penetrate the tissue easily. They do not penetrate the cells easily. They remain in the plasma. For example is heparin. Heparin is found in the plasma only. We do not see this easily in the tissues, right? Now let's see the lipophilic nature. Lipid insoluble drugs they are restricted to the plasma, they are restricted to the plasma only. They have very low AVD, and they are restricted entry, so they do not enter the cell because the cell membrane is having lipid nature, and these are lipid insoluble. Next is lipid soluble drugs. They are very high AVD and they are uniformly distributed because of the same, like the cell membrane is lipophilic in nature, and the drugs are lipophilic, so they are easily absorbed. Now we will see drugs are having some drugs are having very high binding nature or property with the tissues, and because of that sometimes the physiological volume of distribution is impossible, that is very high. So in such cases they do not have these drugs do not remain in the plasma. An example is digoxin, which is found only in the heart and muscles, and if we check the plasma concentration, it will be very, very low. Now we will discuss next topic, which is redistribution. Now what is redistribution? It is applicable only for the highly lipid soluble drugs. Now highly lipid soluble drugs, what they do is they first get absorbed into the central compartment, and then they get distributed to the peripheral compartment. That is, highly lipid soluble drugs initially distributed to the organs with high blood flow, that is the central compartment, and then it gets distributed to the peripheral compartment. What this does is that whenever there is action, whenever this site of action is the central compartment, these drugs become ineffective because they get distributed, because they get redistributed. To be more specific, they get redistributed. So that is a disadvantage of the highly lipid soluble drugs, and their plasma concentration decreases. The site of action for highly perfused organs, in such cases the redistribution leads to termination of the action of drug, as we discussed. Now let's discuss the physiological barriers to the distribution. It includes two, that is the blood-brain barrier and the blood-CSF barrier. We know that blood-brain barrier is generally the most resistant barrier, which is acting as a barrier to almost many of the different chemicals to protect the brain from harmful toxins and drugs, and the blood-CSF barrier does the same function. This is due to the lipoidal nature of this barrier and the efflux transporters present like PGP, and anion transporters present like the O8TP, which is organic anion transporter. Another is enzymatic barriers are also present on this layer. There are many sites where blood-brain barrier is absent, and in such areas like CTZ, the drugs can enter and can cause the CNS effects, which we generally consider as a side effects. Now next we will see is the placental barrier, and what importance does it carry. So placental barrier is an incomplete barrier, and this is also lipoidal in nature. So lipophilic drugs can easily enter or pass through the placenta. Almost any drug, because most drugs are lipophilic, taken by the mother can affect the fetus. So during pregnancy the drugs have to be prescribed very carefully. Okay, so the free passage of lipophilic drugs is there because it is an incomplete barrier. Now we will discuss about the plasma protein binding. Many drugs are there which have very high affinity binding to the plasma proteins. Let's see this. These are the plasma proteins, and these are the drugs which are binded to the plasma protein. Now let's see that the acidic drugs generally bind, or like they mostly bind with the albumin, and the basic drugs bind with the alpha 1 acid glycoprotein. This is, we must remember that the basic drugs bind with the alpha-amino acid glycoprotein, acidic drugs with the albumin. Now let's see the clinical significance of this plasma protein binding. Why we must understand this topic. First, that because of binding, it has a smaller volume of distribution because it remains in the plasma, so it will not get distributed in the tissues. Second is temporary. It acts as a temporary storage of the drugs because the elimination will be slow and there will be slow release of the drug. This will help in the long acting property of the drugs. Next is that it is not removed by hemodialysis. So in case of poisoning, these drugs are difficult to getting removed out of the body. Then we see displacement reactions in the plasma protein binding also. Now let's see the clinical significance of the distribution. That means why we are understanding this topic. Now it includes the case of poisoning, which is very important, that whenever any drug is having very high volume of distribution, it will get distributed into the tissues and the drug will have a very low amount in the plasma. So these drugs are not easily removed by hemodialysis. We need some another method of treatment. Next is that because of having very high volume of distribution, the T half is generally longer, right? So the elimination is slowed down, so they are longer acting drugs. But this will be a problematic issue in case in the pathological states like congestive heart failure. Because of decreased blood flow, there will be accumulation of metabolites. So this was all about distribution. Thanks for watching the video. Please do subscribe because it takes a lot to create these videos.